Hi, I'm Dr. Andrew Kaufman. I'm a dermatologic surgeon in Thousand Oaks and Santa Barbara. And I'd like to talk about one thing that's very important, and that's what do you do if you've been diagnosed with a skin cancer? Now, it really in part depends on where it's located. There's a lot of different ways that you can treat skin cancer. One option might be to scrape and burn it. There are some topical medications that work. You might have it surgically excised or treated with radiation. Another option, something I specialize in, is something called Mohs micrographic surgery. And that's a technique where we trace out the roots of the cancer. So we start with the smallest margin possible and then trace out the roots. What that does is it gives us a cure rate of about 98.5% to 99% and also provides us with the greatest amount of healthy tissue around. That excess healthy tissue allows us to do a simpler and better cosmetic reconstruction. Now, a lot of people ask, how do I know if I have a melanoma, or when should I go in to have a mole checked? Well, there's one thing. First off, it's always good to see your dermatologist once a year for a complete skin examination. The other thing is you should start doing a monthly self-examination, and what you have to do is learn the ABCDs of melanoma. A stands for asymmetry, meaning if you cut it in half, one half doesn't equal the other half as far as size and shape. B stands for border. Instead of a nice smooth border, a melanoma might have an irregular or jagged or blurred border. C stands for color. Melanomas tend to have colors like red, white, blue, or black, or varied color within it. And then D's diameter, larger than the size of about a pencil eraser, 5 or 6 millimeters. So now, while you might have something that has one or two of those characteristics, doesn't mean it's melanoma, but it should be checked out by your dermatologist. The final thing, A, B, C, D, and E for evolving or changing. So if you have a mole that's changing, you really should have your dermatologist check it out. So monthly self-examination, annual self-examination, or annual examination by your dermatologist. Use sunscreen and sun protective measures. Those are the best things you can do to help prevent melanoma.